Today, we are going to talk about joints. So joints are the structures, not tissue, because collagens, fibrous tissue, bones, these are tissues. But once all these structures comes together, it becomes a structure. And now we are going to talk about structure of the human body. And the first structure will be joint. So in our everyday life, we see joints in many different ways. The first thing we can easily remember is the joint on our doors, the doors which we open and close every day, like your room door. This is a hinge joint, which has some or many flexibility to move, open and close the door. So let's define what is a joint. A joint, it is a site where two parts of the body are fitted together. So one, two body parts come and attach together and joint, it is a joint. But in medical term, because we are going to join the different parts of the human body, usually the part of the body surface is called joint surface, in other words, articular surface. So the medical term for the joint would be connection of two articular surfaces. Why do we need joints? What are the functions of joint? The first, I think it's easy to say, hey, the joints, they are useful for movement. Just bend it, flex it, stretch it, which can be very useful for our day-to-day life. And a mobile or even non-mobile joint, they are supportive. How can a joint support our body? Hey, let's have a look. So this is a picture of child with arthrogryposis. Arthrogryposis is a congenital disorder, so they are born with that, and the causes are known. It is non-progressive problem, but the baby is born with the rigid joint. So they do have joints, but these joints, they do not move. They are stiff. That creates a lot of problem. Okay. So now we know the definition of joint, and now let's classify joints. As usual, at least there will be two ways to classify a joint. And the first way is according to the structure, according to how they are built. If they are built with the fibrous tissue, we will name the joint as fibrous joint. If they are made with the cartilage tissue, we will name this joint as a cartilaginous joint. And there is another special type of joints, which we have many different types of joints in our body, which is called synovial joints. Another way to classify joint is depending on their function, which is synarthrosis. Arthrosis means it's a joint. Synarthrosis, syn together, which means the joint doesn't move. It's fused. Amphiarthrosis, amphibious, like it might have two ways, which is like the joint is fully immobile or might be partially mobile or might have some movement. And diarthrosis, these are the joint which has good movement. So let's start with the fibrous joint. So as by definition, a joint is a combination of two articular surfaces. Two bones meet together and they are joined by the fibrous tissue. That's what we call fibrous joint. So because of this, its characteristics are, number one, there is no joint cavity. So it is well fitted and there is no more space. And there is no movement because the dense fibrous tissue attach two things together. Let's say if we think about our teeth, they are embedded in the bony substance of the mandible. They are very well fitting. They don't move. And this is a form of joint as well. That is a fibrous joint. So the fibrous joint can be classified again into sutures, syndesmosis, kyphosis. So I would say this is important to know. Of course, you will gradually forget about all these things. But when we are doing anatomy, especially when we are studying for joint, especially for the September exam, this will be important. So as we say, there are three types of fibrous joint: suture, syndesmosis, and kyphosis. Suture, as we all know, suture means stitching it together. And then the two bones are joined together. There is minimum or no more movement, and they are joined by the fibrous tissue. So this fibrous tissue is also in continuity with the periosteum. I believe we all remember what an periosteum is. It is just the sheath which covers the bone. And these fibrous tissue gradually become ossified and there is no more joint. It is completely fused. That is a suture joint. So the flat bones in our cranium, the skull, it is made of multiple different sheets of flat bone, which is joined together with the fibrous tissue. Second type of fibrous joint is syndesmosis. So in this type of fibrous joint, the fibrous tissue become denser, thicker, and become bands. They could be short or long, but stay acting as suture joints. And number three type of joint, fibrous joint, is kyphosis. It is, as we said, our tooth is deep well buried in the bone substance of the mandible. That is also a joint because in theory, two surfaces meet together, which is joined by the tissue. So these are the examples of fibrous joints. So sutures, as like our skull bone or the cranium, which two bones meet together. These bony surfaces, if you look at that, they interdigitate into each other. On top of that, they will be connected by the fibrous tissue. When you're young, these junctions are stay soft so that it gives a chance for the brain to expand. But once you become mature, the fibrous tissues become ossified. There is no more movement. A good example of syndesmosis joint is around the ankle. So we know that we have tibia and the fibula, which makes ankle joint. These two bones are wrapped or connected to each other so that they don't split out. And that ligament with other ligaments forms a very stable structure. And because two bones, which is fibula and tibia, come and meet each other, that is a syndesmosis joint. And gonphosis, I'm not going to repeat it. That is also another form of joint. Let's go to second type of joints, which is cartilaginous joint. So in cartilaginous joint, where two bones are connected to each other by cartilage. So again, it is pretty similar. It is not fibrous tissue, it is cartilaginous tissue. And the characteristic is the same. There is no joint cavity. There is no or minimum movement. There are two types of cartilaginous joint. First is synchondrosis, and second is symphysis. So what is synchondrosis? Synchondrosis means hyaline cartilage and bone joining to each other. And symphysis is the bone ends are covered with hyaline cartilage. On top of that, fibrous tissue come and combined together. Okay, so symphysis means it is gradually more complex. It's not purely cartilaginous joint because it has got fibrous tissue around there. We go to next slide. So when we are young, from the previous lecture, we know that there is a growth plate, which we call physis. A physis is attached to the bone because cartilage, physis is cartilage, and the bone attached to this cartilage, and in theory, the bone and cartilage junction becomes a joint, and that is called hyaline cartilage and cartilaginous joint. So the same thing on the rib where the collarbone, clavicle come and attach to the sternum, our chest bone, and that is also a cartilaginous joint. The symphysis is like just our pubic symphysis, or the other example is our spine. So because as we know, we have two pelvic bones meet in the center. These bones are covered with the hyaline cartilage, and these bones together wrapped around each other by the fibrous tissue. So number 3 type of joint is synovial joint. It is a very special joint. We have many synovial joints in our body. When we got arthritis, when we got joint inflammation, these are the main joints which gets involved. So it is important to know the synovial joint. What are the characteristics of the synovial joint? So the bone ends which forms a joint, they are covered with the joint hyaline cartilage. So the joint bone surfaces are covered with the cartilage. That's number 1. Number 2, they have a joint capsule. Capsule means it is, let's say it is just a joint lining, which is a very thick structure, and it has 2 layers. So the outer layer is much tough, and give some sort of stability. And inner layer is like just like carpet, nice and smooth inside, where there are many different cells which secrete fluid, which is called joint fluid, in other words, synovial fluid. And the joint have a cavity, not like the fibrous or cartilaginous joint. And there will be ligaments in and around the joint, which is inside the synovial joint, or which might be acting as a supporting structure outside the joint. And these joints are very richly supplied with the blood vessels and nerve. That's why if you put a lot of pressure into the joint, let's say, for example, a knee joint, if you put lots of water inside, the joint capsule will get tense and it will be painful. So these are the special characteristics of a synovial joint, and I want you to remember that. So a synovial joint secretes fluid from the joint inner lining of the joint capsule, and it is a ultrafiltrate from the blood plasma. So it comes from the blood. That's number one. What does it do? It lubricates the joint so that it has better gliding movement. And these fluid contain nutrition to the joint cartilage. Very small amount, even in a big joint, like a knee joint. The maximum capacity it normally has is just less than 5 ml. Some books we see just about 2-3 mLs. So in our knee joint, there will be some fluid which is in very minimum amount. So once the knee joint is swollen, that means the fluid is more than 5 ml. And these synovial fluids contain many different nutritious just like hyaluronin, lubricant, protease. So anything to give nutrition and gliding, lubricating the joint surfaces so that there is less wear and tear with our daily movements. A synovial fluid is a non-Newtonian fluid. Non-Newtonian fluid means the viscosity of the fluid change with the flow. So when we say non-Newtonian fluid, there will be Newtonian fluid as well. So for example, for Newtonian fluid is just water. So let's say if you take a bucket of water and if you stir that water with your stick, the viscosity of water remains the same. So in non-Newtonian fluid, for example, that fluid is like paint. If you open a packet of paint and if you stir with the stick, initially it is easy and it has got higher viscosity. And once you stirring go and on, it is easier to stir, the viscosity reduce. So synovial fluid is non-Newtonian fluid. We still need to talk somewhat about this synovial joint. The first thing is articular congruency, ligaments and capsule, and the muscles around the joint. So I think the easiest way to think about this is just knee joint, which is very superficial joint, which we can see every day with the simple naked eye. not like hip joints, similar joint. Both knee joint, hips joints are synovial joint, but hip joint is too deep to look at. So let's take example for the knee joint. So in the knee joint, the lower end of the femur become condyles, and upper end of the tibia, they are more or less flat surface. So to make the knee joint stable, there need to be some sort of anatomical congruency, which we call articular congruency. So there will be some shallow groove for the condyles to come in. There will be ligaments inside the knee, for example, like cruciate ligaments, and ligaments outside the knee, for example, like collateral ligaments, and the joint capsule, which is really important, and the muscles around the knee, which might be the most important to give the stability of the knee. So a human being can live and use the knee joint without the ligaments and capsule. But if we remove the muscles from that person, the knee will not function. So the other structures of a knee joint or other synovial joints, as I say, we just stick with the knee joint. There could be articular disc. So in the knee joint, these are the keyhole surgery, arthroscopic surgery of the knee. There is meniscus. We learn from the previous lecture, like fibrous, when we are learning fibrous tissue. This is a form of fibrous tissue, which is called meniscus. It acts as a cushion in between the two bones of the knee joint surface, so that two hyaline cartilage doesn't meet and not impacting each other every step we take. And because of that, the joint has better congruency. The arthroscopic picture on the right side is showing torn meniscus. Once we have torn our meniscus, it becomes painful and it becomes unstable. The knee becomes unstable because it is just like, you're walking on a cushion, which usually gives you stability. But when that cushion is torn, you are just walking on a ragged structure that gives you a sense of instability. There is another structure which is called bursa. Example for the bursa is around the shoulder. So these pictures show you the shoulder joint. So as we know, this is the glenoid, this is the humerus, and this is the head of the humerus. And this is acromion, which is part of the scapula, and the rotator cuff tendons, which is, let me go back. Rotator cuff muscles and tendon, which is running just below the acromion, above the humerus. And these tendon, to prevent these tendon gliding and to prevent rubbing with the bones, they give us a water cushion, which is called bursa. So here we can see subacromial bursa, which give protection when the muscles and tendon glide underneath the acromia. So this is a much bigger picture. So a tendon is running and there is a cushion. This is the bone surface. So to prevent this tendon rubbing to this bone, we have put a cushion. So that is a bursa. So the clinical implication is with time and use, these bursa can become inflamed. Next slide. This is the MRI scan, again showing the shoulder joint. So this is the axial or transverse section. This is the coronal or anterior posterior section. And this is again the axial section. This bone is glenoid, and this is the head of the humerus, which forms the glenohumeral joint. If you look in this picture, the head of the humerus, the shaft of the humerus, this is the glenoid, and these are the rotator cuff tendons and muscles here. And I believe this is the coracoid process. And there will be acromion here, and this is the bursa which is inflamed. So let's imagine this is a knee joint, which is the synovial joint. So let's say this is the lower end of the femur. This is the upper end of the tibia. The joint, the green synovial membrane, which is the inner layer, and which is there is fibrous layer, which is the outer layer of the joint or articular capsule. And there will be cavity here, which there could be some fluid. But remember, even in a large knee joint, there is just about 2 to 5 ml of fluid in the joint. And usually, in synovial joint, the joint surfaces are covered with the hyaline cartilage. And there will be ligaments around the joint. Okay. So movements of the synovial joints, how do they move? Number one, they just slip on each other, which is called gliding. Number two, they will change their direction, which is called angulation. And number three is combination of everything, like it's rotate, just twisting around and around. That is called rotation. So for example, rotation is your shoulder joint. You can move nearly 360 degree. The example for angulation is your elbow joint. You can flex it and you can extend it. You cannot do much. Gliding is one bone is gliding over each other. The best example is the little bones in our wrist joint. So let's classify synovial joints. Usually we use according to their shape, but the easier way to remember is according to their movement. So non-axial, uniaxial, one direction, biaxial, both two direction, multi-axial, multiple direction, non-axial means it's no. So more important classification is shape, according to the shape, which is plane joint, hinge joint, condylar joint, pivot joint, saddle joint, and ball and socket joint. So let's go and understand these type of synovial joints, which is classified according to their shape. So if you look at the bones in our hands, you know that small little bones, there are 8 bones in our wrist, which are called carpal bones. They are too small and very tightly arranged. That's why the maximum they can move if they just glide on each other. So that is a plane joint. So as I say, hinge joint, good example is elbow. Your elbow can flex and extend, and that's it. The pivoting, so rotating on one another, it is your proximal radial ulnar joint. Proximal at the upper end, radial ulnar, radius and ulnar bone in our forearm. So radius bone rotate on the ulnar at the proximal end. That is a pivoting joint. So condylar joints, there is some similar to ball and socket, but they are not as deep. One is dome, one is socket, similar to ball and socket, but they are much shallower. So those joints in our fingers, these are the condylar joints. Saddle joint. So if you look at the picture, you will see like a saddle, this is saddle of the horse and you are putting saddle on top. So this is a saddle joint. That is in the ankle joint. The ball and socket joint is pretty common, like your shoulder joint or the hip joint. So let's go and conclude. So a joint is a structure. It is a connection of two articular surfaces. There are three types of joints according to their structure. They are fibrous joint, cartilaginous joint, and synovial joints. Fibrous joint can divide it into three further smaller group. For cartilaginous, there is only two, synchondrosis and symphysis. And for synovial joints, there are three different types of synovial joints. Synovial joint has many different characteristics, which is important. So why do we need to understand about these structures of joints? Because it is important to our everyday, day-to-day life. And now I'm going to show you this slide. This will be the last slide for the lecture. Because everyday life, whoever works in the medical field, we are going to see this scenario, like a painful swollen joint. So those patients who came to ER with the joint, pain, swollen, unable to move. So the first important thing we need to check is make sure there is no history of trauma. So any fracture or broken bone inside a joint, which is trauma, that will give you painful swollen joint. Tumor, for example, like malignancy, cancer, which is in and around the joint, give you pain and swelling. It will be disaster to miss a cancer. And number three is infection. So infection near the joint or inside the joint. So once we can exclude this trauma, tumor, infection for a painful swollen joint, there are a few things we need to check. So inflammatory condition, for example, like rheumatoid arthritis or psoriasis, can give you a painful swollen joint. Crystal arthropathies, for example, like gout or pseudo-gout, where the uric acid crystals or calcium pyrophosphate crystals accumulate in the joint, can give you pain, swelling in the joint. And osteoarthritis, which is a degenerative disease, which is very common in our day-to-day life, can give you painful swollen joint. And of course, not the least, hematological, which is like hemophilia or any drugs like apixaban, warfarin taking, they change the bleeding and clotting capacities, and then bleed inside the joint and give you a painful swollen joint. Okay, we are going to stop here. Thank you for your attention.